Hi all, welcome back to my channel. This is Geetu Chandra and you're watching Geetu Chandra Vlogs. In today's video, we'll be discussing more about listening part B. So here I will be discussing about the overview of listening part B and the format of the questions and the types of questions you can expect in the listening part B. At the same time, what are the strategies and methodologies you can adopt to improve your scores in listening part B. And this will help to succeed a great score in your listening. So I hope this will help. Before moving into the sessions, I just want you to request one thing, that please subscribe my channel, that if you find it really useful, and please share, gives me a thumbs up. That will give me a lot of inspiration to do a lot of videos. So don't forget to do that. Let's move on to the session for more details. The overview of listening part B. It consisting of 10 minutes. Total 10 minutes you'll be getting to complete this session. Here you'll be having 6 questions. In that 6 questions, you'll be having 3 options. Among the 3 options, you have to select the proper answers. Okay, so 6 questions with 3 options. This is the way you will be getting. And the questions scenario, this audio extract, how it will be. It may be a teaching session, or it may be a discussion, or it may be a briefing, or a kind of training session. So these are the chances that you may get the conversation. The audio extracts may be like that. Okay, from that audio extract you have to listen the main content and you have to get the proper answer. This is all about overview of listening part B. Alright, next we will discuss about the format of listening part B. Okay, here as I told you before that you will be getting a workplace conversation, so workplace scenario. Okay, in that here you'll be getting a condensed statement. Okay, condensed statement and a questions and 3 options for each questions. Okay, for the condensed statement you will be getting the main idea of that workplace audio extract. For example, you'll be getting who is talking, to whom is talking, what they are talking about. For example, a nurse is briefing her colleague about her patient. So here, who's talking? The nurse is talking. To whom? To her colleague. What they're talking about? About the patient. So these all things you'll be getting from the condensed statement. Once they finish the content statement, they'll give you a 10 seconds gap. This is very crucial, so you need to understand why it is given. So it is given to understand the questions and to understand the main difference between each options. Okay, this is a very important thing that you need to remember during your exams. You have to be very fast in reading the sessions. So this will help, I think. So let's move on to another session to understand what types of questions you can expect. So what the question is requesting you to answer. So this will be discussed in the next session. So let's see that. The type of questions that you will encounter in the listening part B. First type is guessed. Here you have to select option or to answer in such a way that will summarizes the exact thing in the audio extract. So that will give a summarized idea about the audio extract. Here you are getting an overall view of that audio extract in a single statement. You're not supposed to select the specific information which is mentioned over there. I think this sounds better. Next one is the detail type of questions. Detail. Here they are asking about the specific information which is heard in the audio extract. So you have to concentrate on the specific informations. So be aware that they will not use the same words which is mentioned there in your questions. They may use the synonyms. So be alert on that. Okay. For example, the patient's medication is changed because. So you should understand why it is changed. So in the audio extract, they have mentioned something about the reasons, some specific reasons for changing his medication. So you have to concentrate on that specific detail. So be aware that, always aware that they will not use the same words which is mentioned in the questions. They may use synonyms. This is the main thing that you need to remember. Okay. Next one is speaker purpose. Here you should understand what is the aim of the speaker. For example, what they're talking about, why they're talking, what is their ultimate aim. So by understanding these all things, you'll be able to give the answer. For example, the doctor explains that the patients should. So you should understand why he's asking that. So you should know his aim, the speaker's aim or speaker's purpose. You should be able to understand. So this is about the speaker purpose. Function. Here the question asks about what the speaker is doing, what they're doing. Okay, so this you need to understand. So in this type of questions, you may expect questions like what the nurse is doing, sometimes why the patient called the doctor. So you need to understand the function of the speaker. Okay, so this is the type of questions you may get in your listening part B, the function type of questions. Next is the opinion type of questions. In this questions, here it asks about describe the opinion of the speaker. For example, how does she feel about the situation? So always pay attention to their attitudes towards the issue being described over there in the audio extract. So it always about opinion or their attitudes towards that situations or that issues being discussed. So this is the opinion type of questions. Agreement type of questions. In this question will ask you to identify in what the speakers are in agreement with. For example, the physiotherapist agree that they will. So here you have to concentrate on, or you have to pay attention towards how the speaker react to others' conversations. So this will give you an idea of about their agreement. Okay, so this is about agreement. The last type is course of action. Here you need to answer as a result of this conversation what the speaker will do or they have to do as a result of their conversations. For example, nurse advises her colleague to do something. What she is advising her to do. After discussion, she must do something. So what it is? So it is based on the discussion. So here, the course of action you need to select and give the answer over there. So always pay attention in what time it is to be done. For example, maybe today or tonight. So you have to listen that words or the timings that you need to give the care, or sometimes the course of action. So this is about course of action. So here ends the types of questions that you may encounter in your exam. Okay, this is the listening part B. Next, we will see what is the method you can use for answering this question. So always listen the question skeleton. Okay, the content statement. There you will be getting who is talking, to whom is talking, and what they're talking about. Once they finish the audio extract, you'll be getting 10 seconds. Read the questions very fast. Okay, then within 10 seconds you need to read the questions and 3 options. So you have to identify each sentence. From there, it is okay that you can underline the words, that is, which is giving a main idea of that sentence. For example, regarding something like dressings of the wound. So advises her to clean the wound from clean to unclean. So you will be underlining clean, unclean to clean to unclean. So you will be underlining the main words over there. So you'll be getting that this is the main idea of that statement or the portion. So this will guide you to answer. Once you will be understanding the main or major differences between 3 options, once you listen the audio extract, you will be able to understand what is being discussed and how you need to be eliminated. Always, always, always eliminate the wrong answers, which will guide you to the right answers. Don't go directly and select the right answers. You may fail, you may get a wrong answer over there. So this is my key advice that you should follow, because this will help a lot. And one more thing, I need to give you an instruction that don't answer the questions before the audio extract finishes, because at the end it may be giving some ideas or clues. Okay, so don't try to answer before the extract finishes. So try to answer once the audio extract completely finishes. Okay, this is what about your listening part B. So this gives you an overall idea. So let's have a random session. So I have selected some of the questions which is there in the official of OET website. So that will help you to give an idea about how to answer the question. So I have selected 1 or 2 questions from there. So let's try that answer. Try to find out the answers along with me. Okay, so I think that will work more for you. Okay, let's move on to that session.
I'll look at question 25. You hear an optometrist talking to a patient who's trying contact lenses for the first time. Now read the question.
Now, you've had the lenses in for a few minutes. How are they feeling?
Not bad. I thought I'd feel them actually touching my eyes, that they'd be sore or prickly, but I can't feel much at all. My eyes do feel a bit watery, though.
It's okay. You've just used too much solution. Now, in a few minutes, I'll get you to try taking them out and inserting them again by yourself.
I had no trouble taking them out earlier, but I'm not confident about putting them in. I worry I'll press too hard.
That's unlikely to happen.
Things look rather distorted, though. I mean, I can't make out the letters on that chart.
Any of them?
Those lower down.
Let's give things another minute to settle down.
So let's read the questions. You hear an optometrist talking to a patient who's trying contact lenses for the first time. Here, the person who talks is optometrist. He's talking to a patient and is talking about the contact lenses because he's using it for the first time. Okay, and the question is, what is the patient concerned about? So you should understand what his feeling is, what is his problem, what he's telling. So here the options: option A, his blurred vision, he's having problem with the visions. That's the option. Option B, soreness in his eyes, that he's having pain. Option C, how to remove the lenses. Or you have to think about, is he telling about there is some issues in removing the lenses. So we have to concentrate all 3 points. So in the option A, you'll be concentrating about blurred vision. So is he complaining about any problems with his vision? So if he is complaining about any soreness in his eyes or any pain in his eyes, or sometimes if he is complaining about he is having difficulty or he's feeling difficult to remove his lenses. So you have to keep all those things. If you want, you can underline blurred vision, soreness, remove the lens. So for your understanding, I have taken the transcript over here. So see, in the patient statement, he says, what about the feelings when he is using that lenses? It's not bad. I thought I would feel them actually touching my eyes, that they would be sore or pricky. He was thinking like that, but I can't feel much at all. So he's saying that directly, that he's not feeling any pain or any soreness. Instead of pain, they have used soreness over there. Okay, then another point they have mentioned, like, I had no trouble taking them out earlier. So he's clearly saying that he is not having any difficulties in removing them, but he's simply saying, I am not confident about putting them in. So you might get confused over there. So think that he's saying that clearly he's not having any issues with taking them out. So the answer, see here, things look rather distorted though. I mean, I can't make out the letters on that chart. He's saying it is looking distorted, or he's unable to make out the letters, in the sense he is having a blurred vision. He's unable to read. So the correct answer is option A, his blurred vision. That is the correct answer.
Question 26. You hear a nurse asking a colleague for help with a patient. Now read the question.
Kathy, could you help me with the patient in bed 103? The woman who had surgery 2 days ago.
Oh, yes, she's due for discharge today, isn't she? Does her pain relief need topping up again? I thought she wasn't very comfortable this morning.
Oh, she's on a reasonably low dose, but she's coping. She needs her chest drains removing, though, and she's got herself into a bit of a state.
Ah, well, that's a two-person job anyway, so I'll come with you. Has the consultant seen her? I know there was some concern yesterday about her condition and the level of the fluids draining into the bags.
Oh, he's cleared her for removal of them today, but I think some reassurance might be needed first.
Right. I might just check her analgesia and give her more before we go ahead.
Okay.
Question is, you hear a nurse asking a colleague for help with the patient. Why does the nurse need help? Option A, the patient's condition has deteriorated. Option B, the patient is worried about the procedure. Option C, the patient is reporting increased pain levels. So what is the difference between each options? So you should understand why she needs help, why the nurse need help. Sometimes option A, patient's condition means there is a deterioration. If they are saying about deterioration, so you have to think of it. Worried about the procedure, the patient worried about the procedure, and other one, the patient reporting increased level of pain. Okay, all right, let's look into the transcript for the detail. Okay, here see the dialogue. Oh yes, she is due for discharge today, isn't she? Does her pain relief need topping up again? I thought she wasn't very comfortable this morning. So the male is answering like, oh, she is on a reasonable low dose, but she is coping. So here you can say that she is having a low level of pain. There is no much pain. She is not complaining about the pain. And I didn't see anything which is mentioning that her condition is deteriorating. So there is nothing like that. So what could be the answer? Well, that's a two-man job anyway, that procedure. Okay, so I will come with you. Has the consultant seen her? I know that there was some concerns yesterday about her condition and the level of the fluids drained into the drainage. Oh yes, cleared. But I think some reassurance might be needed first. So they're saying that she is little bit concerned about the procedure. So here the answer comes. So you can clearly state the answer. Okay. So the answer is option B. The patient is worried about a procedure.
Question 27. You hear a senior nurse talking about a new initiative that has been introduced on her ward. Now read the question.
One of our key priorities is improving communications between staff, patients and patients' families. We recently introduced a scheme called Dear Doctor, which involves giving each patient a card where they can make a note of any questions or concerns that they themselves have. They can also talk to their families during visiting time, or even on the phone, and see if there's anything else they'd like to add. The cards are then collected and given to the doctor before the ward round. We're really pleased with the response. Patients used to say that they only thought of the things they felt they needed to discuss when it was too late, so the cards give them a better chance to bring up whatever's on their minds. In fact, it's been so successful that we're going to roll it out on all wards in the hospital.
Here I'm not going to give you the explanation, you just need to find out that one. So the answer is option C, patients not discussing all their concerns when meeting the doctor. Alright, that is the answer.
Thank you so much for supporting me. Thank you so much for watching this video throughout. Okay, and I'm really overwhelmed. I'm really happy, and it is really inspiration that someone is giving you some feedback. If you give me a comment over there, it is really like an inspiration to me that gives me a motive to do it again, do it more helpful. I'm really happy to know that somebody is getting some help from my videos. So I'm really glad that I'm helping someone to gain their goal or ultimate objective. So I'm really happy that if you don't mind, Please leave a comment if you find it really useful. I'm ready to help you at any time, and if you have any doubts, you can mention that in the comments. I'll be back with another video with interesting topics, and I'm doing some grammar videos also. So if you require anything, you can please put that one in the comment. So please be supportive always. Keep the comments and keep supporting me. Thank you so much for watching my video. Let's meet again in another video. Thank you. Until then, it's bye from Geetu Chandra.